Hi, Jamie. Hi, Anna. Thank y'all for joining me. All right. So, since I wasn't here yesterday, I figured I would make it up to y'all. Do a live and talk about. I think there's a season of people wanting to get into like coding and CDI, and I'm really kind of referring to my medical people already, like my nurses, my surgical techs, radiology techs, all of my techs that want to get into coding and they think it's going to be an easy transition because they already have this medical background. So it should be an easy thing for them. And I want to talk about that because I think it's very important. There's a lot of these schools, a lot of these programs that will take advantage of medical people playing on their ego and saying, "Oh yeah, you can do this is no problem, and you get to work at home, and you can make all this money, and blah blah blah, and it's so easy." The electronic health record's doing it, and all this garbage. The electronic health record is a tool, okay? Just like computer assisted coding is a tool, just like the encoder is a tool. These things are tools. They don't have the ability to critical think, which is why we have jobs, okay? No, AI is not going to take over. And no, no one can tell me any different because if you're from the tech industry trying to tell me that, you're not in my industry. I am. I'm the one boots on the ground who sees everything. You don't know everything, especially somebody's coming over from tech, okay? Just putting that out there. All right. Um, ooh, at the casino, waiting on a friend, still watching you. Oh, well, I feel really special today. Thank you. That is awesome. Enjoy the casino. I miss Vegas so bad. Anyway, so here's the thing. So I'm going to talk about this message that I got from this lady. And my thing is this, when like people find my channel, they're so excited. "Oh, Blue, you're just so straightforward and honest, and what do you think about this?" And it's always something that I've already discussed, to the nth degree on the channel, and they're still asking me for advice. So I'm going to read the message here in a minute. Hi, Gina. Hi, Claudie. I can't say your name. Nuria? Nuria? Enjoy the casino, Nuria. All right, so we're going to go ahead and get into the message today. So the viewer wrote in and says, "Love your content. I found you on YouTube. Could you help me navigating obtaining my CCS or CDIP credentials?" CDIP, if you don't know, is a certified documentation improvement or clinical documentation improvement practitioner, or maybe now it's integrity. But it's a CDI credential, right? I'm in Georgia, and 99% of the hospitals require a CCS or CDIP credential. I have not had much luck finding a CCS boot camp training. I'm in Georgia. Can you recommend any school preparation for the CCS? I'm a registered nurse. I'm an ICU care coordinator and worked as a NICU nurse for over 10 years of laboratory services and over 10 years of laboratory services experience. For my civilians, I'm not military, but I know this. I know this word, boot camp. Boot camp is 60 days. That's how long boot camp is. And again, there's people that are playing to these nurses. "Oh yeah, you can get that. You can get certified in 60 days. You can pick it up." You cannot. You cannot. And I don't care how smart you think you are. If doctors cannot understand what we have to do as coders, and their work depends on us, their pay depends on us, their productivity depends on us, if they still can't understand this, what makes you think you're any better? That you as a nurse, or you as a radiology tech or lab tech, whatever, what makes you think that you're any better than a doctor who can't understand this either? It takes time to understand. And with the CCS, you are tested with 3 manuals. However, you have to know 4 manuals out of the gate. The CCS is the advanced. It is the gold standard. Other people will describe their credentials as, "This is the gold standard." No, it's not. No one beats the CCS. Why? Because the CCS is mastery of inpatient coding and outpatient coding. 2 different thought processes, 2 different mindsets. and 2 different procedure manuals that you got to know. Okay, so you got to know 4 running right out of that gate. I would never ever recommend a boot camp. And then of course you have somebody, because I posted this on LinkedIn and it got a lot of comments, which is unusual for LinkedIn for me, because it doesn't usually blow up this big. However, this one lady, she came on there, oh yeah, such and such has a really good boot camp, blah, blah, blah. No, ma'am, your comment is not warranted here, especially when I said you can't learn this in 60 days. This person has no prior background in coding and expects to just take a boot camp and learn the CCS. No, you can't. You need to learn it the way everybody else learns it. You need 9 months, 12 months, or 18 months. And even if you say, well, Blue, I'm a nurse and I studied for 6 months and I still was able to pass it. How competent are you? Let's talk turkey. How competent are you? Would you be able to explain to me what the global period is? Would you be able to explain to me what modifier 55 is and when it applies? Would you be able to explain to me initial, subsequent, and sequela for injuries? Would you be able to explain mother-baby coding, what the difference is? And with mothers, what do you have to have in order to be able to select the codes? Would you be able to do that? Probably not. There's a good chance you will not. Oh, and let's not forget about evaluation and management, everybody's favorite. So there's a lot of things that you have to learn. So when I say, no, you cannot learn this in 60 days, I don't need somebody coming up on here and saying, oh, well, such and such has a good... No, I'm blocking you. Because first of all, you're not going to advertise somebody else who I don't know their product. I don't know their product. If I don't know their product and you start saying, oh, yes, this person's so... No. If I don't know them, it's coming off of there. Period. Because this is my channel. And this is my work that goes into posting all of these things. And some of you, a lot of you, don't like what I have to say because, oh, you're so mean. This one lady, she sent me a message. She was like, Blue, I just want to let you know that I passed my CPC and it was thanks to you, but you were so mean to the point it hurt my feelings. Just kidding on the so mean part. I would respect you more if you tell me, hey, you're mean, rather than just trying to walk it back and being this two-faced type deal where you're saying, oh, you're so mean. Oh, no, haha, just kidding. Be real. If you think I'm being mean, just say it. But at the same time, what did it do for you? It helped you to get your rear in gear so that you could pass. So I think I did something right. All you have to do at that point is say thank you. That's all you have to do is just say thank you. You don't need to tell me that you think I'm mean. You don't need to tell me that you think all these things of me. I don't care. What my point is that this industry is filled with people who were pushed in, who were encouraged to get in it, and it's not for them. There's a lot of people that are like that. Then there's a lot of people that get into this, they get real excited, and then all of a sudden they burn out because it's not as quick learning as they thought it was going to be. But then you hear somebody like me who tells you, hey, this is how you got to study, and if you actually follow it, maybe you'll learn something. And then finally, when they give up and say, okay, well, I'll just do it your way, and all of a sudden they start learning, and guess who's having fun now? So I'm just saying, y'all, this is work. It is work. It is not always fun and games. But if you stick with it, it will give you so many more rewards than you were ever prepared for. But it's not for those with a weak stomach. It's not. Okay. So keeping on with the message. So I told the lady that I responded to this comment, and I said to the lady, I said, I have plenty of videos on my channel about how to study medical billing and coding and how to learn so that you can study on your own and so that you can pass the test. You don't have to go through all of that. Oh, well, what boot camps do you recommend? I blocked the lady because first of all, I already done told you can't. And I told her, I said, ma'am, you will not learn this in 60 days. That was the first thing I said. It was, you will not learn this in 60 days. And that was the first question. She came back, oh, thank you for responding to my comment. But what boot camp do you recommend? I blocked her because now you're not listening to what I'm saying. Okay. It's important to listen when somebody's giving you sage advice, because again, if you're not listening, then I'm just going to be wasting my time, right? Just trying to explain things to you so that you can figure out what you need, right? Let's see. Where was that other comment? This other lady, she's also a nurse. And I like this because this is what she said. Preparing for the CDI, I looked into medical coding and realized pretty quickly that it was a maze of information. I went back to the technical school where I obtained my first nursing degree and was thrilled that they had an associate's program for medical coding, medical billing specialist. It was not an easy program, and I'm fortunate that I chose this path. Boot camp is never enough. The boot camp is not enough. So, where was that other comment I wanted to read? Do I need to go most recent? Where did it go? Ah, here we go. So I like what this other lady says too. But there's also a point to be made. So this other lady said, I agree with you, Blue. I tell people all the time that medical coding is not an easy path, even for those with clinical backgrounds. Coding requires a different way of thinking, focused on documentation, coding guidelines, and regulatory compliance. Programs that promise quick results often downplay how much time and effort it really takes to become accurate and confident in this work. That said, if someone is already in healthcare, it's helpful to understand their long-term goals. Are they looking to get into coding, or are they aiming for clinical documentation integrity? There's a difference in how one should approach certification and training based on that answer. For example, CCS and CDIP are both valuable, but they serve different purposes. Plus, if the person is interested in documentation integrity, have they considered CCDS in lieu of CDIP? It's not about shortcuts. It's about knowing your destination and choosing the training that supports it. I 100% agree with what this person says. However, for this person that made the comment about, she's in Georgia and all these hospitals want, a CDIP or they want a CCS, this lady doesn't know what she's doing. And I will never recommend for nurses to get a CDI credential, whether it's CDIP, CCDS, or CCDSO. I don't recommend those credentials for nurses anyway if they have no training in coding. And I emphasize training in coding because there are some nurses who say, oh, Blue, I do the coding. No, you don't do coding. Coding is not circling from a super bill. Coding is not selecting whatever the provider told you and then you're just inputting it in. That is not coding. Coding is when you're actually looking, you're abstracting, you're pulling out information so that way you can make the decision, use that critical thinking to select a code. Okay, because I can look at, I'm an orthopedic coder, for example, orthopedic and podiatry. Those are my main clinics that I code for, but I can code for anything. But those are the ones that I mainly code for. Now, if I'm looking at this documentation and it says the patient has a wrist fracture, right? That's what it comes out with. I know, as somebody who uses critical thinking and who knows the industry and who understands the guidelines and who reads Coding Clinic and CPT Assist and all these things, that wrist fracture is not as specific as, okay, which side is it, right? If they say right wrist fracture, okay, is it intra-articular or is it extra-articular? Where is it? So I can look at the x-ray and find a more specific, the specified location of that wrist fracture, and I can use that code. There's a coding clinic about that. So I know that. But anybody else may not know that. A nurse coming right in off the street with a really fast credential that they got wouldn't know that either. And to know CDI, let's talk about CDI for a minute. So CDI, if you don't know, clinical documentation integrity, right? They used to call it clinical documentation improvement, but now they go with integrity. So whatever, you're looking at the documentation and you're seeing where there's holes. Where can the diagnosis be more specific? Where can the documentation about the procedure be more specific so that the most specific code can be selected? in the example that I just said about the wrist fracture, intra-articular, extra-articular, that CDI could have went to that orthopedic surgeon and say, hey, is this intra-articular or extra-articular? Where is this? So that way there's a more specified diagnosis that's being picked up. Because the more specified the diagnosis that are being selected, the better off the statistics and all the data that comes out of that facility can be, because it's more specific. There's no risk of unspecified codes, unspecified site, which you should never code unspecified site, okay? If you can absolutely help it, you should never do that. But that's the thing that CDIs would do. They would look for those holes. Well, in order to look for the holes, you got to know what you're looking for. If you don't know the first thing about coding, and you just slide into the CDI role because, hey, I've got this clinical background, because also, in order to query a provider, you need to have clinical indicators. You need to have some kind of proof that there's something that's missing here. You can't just be sending a query to a provider because you're trying to up the pay. No, absolutely not. We are not about money on the coding side. We are about looking and seeing what's there so that the provider can get paid fairly for what they're doing. But somebody with a clinical background can see, oh, this provider ordered MRI. But I can look at these labs over here and I can see all this other data and, oh, well, there's something here that's missing, because why would you order an MRI or a CT scan or any of these other things when they have all of these data points here in the labs? Let me talk to the provider. So that's where the nurse would be able to catch that, right? Or if the provider is prescribing another medication, and why did you prescribe that medication? Oh, because I see these labs here, or I see this detail over here that would suggest that maybe there's something else going on. Let's talk about this. Let's try to get this down on paper. You're not looking for extra money. You're looking for that extra detail. But again, how do you know what you're looking for? And it's the same thing. If you want to do CDI, would you know that with the injuries about the global period? Anything that's done in the global period, if a patient has a major global period procedure done, right? The patient with a wrist fracture has an ORIF, right? Open reduction internal fixation. And the provider's not documenting the date of surgery. They're just putting on there the patient's post-op. Well, there's 92 days in total that you get for a major global surgery. You get the day before surgery, the day of surgery, and 90 days thereafter. That's all included in a 90-day global package, right? Which means that all of the surgery and all the visits related to this condition are already taken care of in the payment for that surgery. Okay, so basically when they're coming in to see the provider for that post-op for that surgery within those 90 days, it's all covered. That's why we have 99024. If you look in your book, you'll see that that's what you're doing when the patient is in the global period, okay, for these like major surgeries and even for the minor ones too, but we could talk about that later. But anyway, so for that reason, okay, that nurse is going to have to understand when is an initial injury reported, when is a subsequent injury reported, when is a sequela injury reported. Because just coming in with your knowledge, oh, I'm a nurse. Do you want a cookie? So, do you know what you're doing? You are also the liaison for education between the surgeon, the PA, the nurse practitioner, any of those folks, and the coders. You are that middle person that is taking the concerns from the coder, because maybe the physician is just not listening to the coder. The coder is not strong enough to know that, hey, I need to work on my own personal skills so that way I can meet this provider where they are. Talked about that too. Again, some of my most lowest viewed videos. I hate that because I love provider education and I love sharing about it, but I wish y'all would watch it. Anyway, so sometimes because this nurse is a nurse, former nurse or current nurse or whatever, that physician is sometimes more likely to listen to that nurse before they'll listen to a coder. Because if a coder is meek and scared, they're not going to want to mess with you. Because again, why are you telling me what to do? That's what that's the attitude that sometimes you will catch from these providers. They also pay attention. Remember, these providers have been to school for 10 or 15 years. They know somebody who studies. The second they open their mouth, they know if you're a person who studies, if you know what you're talking about, if you know what you're doing. Now, the second I go in and I meet my providers and I start laying it out for them like this, okay, it's this, 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 and this, and this. I'm going to give you this welcome packet. It's going to break down all these things. Then they're like, okay, she knows what she's doing. And some of them will still try to resist me because they're not used to this. And that's okay. I can work with people, but at the same time, that nurse is going to be really good if they understand what's going on with the coding so that they can hear those concerns from the coders and they can take it back. This is what they mean, because they can speak with the provider and understand, because there is such a thing as speaking coder. I've been told that before. Blue, you're speaking coder. Okay. And I have to break it down another way. But there's that. So when you are interacting with, if you're the CDI, nurse CDI, and you don't have that coding background yet, you better make friends with those coders real fast, or you better find yourself self-studying or find a program that you can get into so that you can learn coding, because that's the only way you're going to be able to communicate correctly and fully with these coders and actually understand what they're saying, because the coders are going off of guidelines or going off of regulations. These guidelines and regulations get updated every year. And sometimes even with the billers, they have to understand what the billers are telling them too, because the billers will say, based on what the insurance is, whether it's Medicare or Aetna or Blue Cross Blue Shield or any of those, they understand the specific requirements of those insurances. So when they're speaking with the CDI, it's very important that the CDI understands what's going on with that too. So and it's not an industry requirement, which bothers me, that CDIs know coding first. It's not. It's the same thing like we are not required as coders to have a college degree. In some countries, like in the Philippines, you have to be a nurse in order to be a coder. You have to be a nurse first in order to be a coder. So I think that that's great, because it shows when you see people in different countries and the level of accuracy that they have, because there's some other countries that I will not name that no, absolutely not. And what makes it worse is that English is not their first language, so they even struggle even more. So again, if you are not taking it seriously, if you're not doing your due diligence and studying in order to make up for the things that you don't know, or building on communication skills, or building your leadership skills, these are things that are going to help you in the industry. Now, I have never had the title of CDI, okay? It doesn't mean that I don't technically do this when I'm working with my providers, because even though I don't have a clinical background, I do have extensive knowledge from all the years that I have been a coder in orthopedics and podiatry. So I know what to look for. When they tell me that there's increased signal, I know what that means. If they're telling me that there's something that's degenerative, I know what that means. There's lots of things that I understand what it means much more clearly than a lot of the other lay coders that don't really know. They're just there to do their job in code. I understand, but you still have to understand what they're talking about. And even when it comes to the surgeries and all these other things, a few years ago when my facility got the Mako, it's a computer assisted machine. They called it a robot. The surgeons were calling it a robot. But when I was looking up the code for that procedure, I was just like, that's not what that is. So I finally found, and I had to do some research and check it out, because there wasn't anything that it was like laid out, because it was so new at the time. And so I was able to do some research, and that's how I found out what actually Mako was. It was computer assisted. It's not a robot. It's not like the Da Vinci robot. It is computer assisted. They do like scans, and they can map out a person's specific anatomy down to the millimeter, and so it's really very fascinating, right? But in order to capture that workload, in order to capture what they were doing, I made sure, even though that's not even what I do, I don't even touch the surgeries, but I cared enough to make sure that they were reporting the correct code, you know? And so again, but that's, and then making sure that everything is there that needs to be there as far as like detail, because sometimes these providers may think that it's common sense that this is this or whatever, and I'm telling them, if it's not documented, it didn't happen. What is happening in this procedure? What is happening when you're with this patient and you're doing this? And okay, they explain it. I said, okay, that's not here. They go, well, that's common sense. And I was like, okay, but you are also not talking to other surgeons. They go, but I am talking to the surgeons, Bleu. Yes, I know that technically. Yes, you are. But also this record can actually be pulled for court, and it can go in front of a judge. It can go in front of attorneys, and it can go in front of, you know, those, what is it? The court appointed people that do the, the mediators, right? It can go there and they could be looking at this. And if it's not clear, if it's not without a doubt, then all of a sudden you have an ambiguous record. And what happened with this patient? So that's why it's very important for you all to understand. And please, if you're brand new, if you don't have a clinical background, don't panic, okay? Again, I had no clinical background when I started. I had no clinical background at all. And I was so far away from the medical field. I wanted nothing absolutely to do with the medical field. I wanted to be an attorney, still do. But I wanted to be an attorney, and that was where my mind was going, not anything in medical. But I ended up, medical coding found me, and I ended up here. And honestly, I would not change it. This is 17 years of my life has been in this, and I'm very proud to say that. I'm very happy with my career and how it's progressing, and this is not the end of the line. You know what I mean? Like, there's still a lot for me to do. But that's the thing that you have to understand when you're getting into this. This is not a game. And there's so many of these nurses out there that they get their ego so pumped up. Oh yeah, I can do this. I've had people get mad at me. They send me nasty messages. Well, you don't know what you're talking about. Okay. Well, no, I did this in 2 months. Okay. You'll still not be as competent as you possibly could be if you just slowed down. There's no shame in listening to somebody that is in the industry and knows what they're talking about. But again, if you're thinking that you're superior, which some of you do, and you can't get mad if I'm calling you out for the things that you know are true. If it's not true, then you're not going to get upset. There was this other lady. She goes, how dare you say I'm lazy? I have never personally said anybody was lazy. What have I said? If you're listening, that actions are lazy. Certain actions that you're doing are lazy. When you're coming up with excuses for why you can't study, and then you're out here in the streets complaining that you don't understand this, you don't understand that, it's all a scam, it's all a waste of time. No, ma'am. You're not going to talk about my industry and be running your mouth saying all these things when let's go ahead and bring it out. Why aren't you grasping it? Because you're not putting in the time. That is lazy. Well, no, you don't understand. I have to do all these things. You don't want to know my schedule. You do not want to know my schedule. And there's plenty of people who make it work, who do so much more. And they're responsible for so many things, and they still make the time because it's what they want. Because they understand and they can hear me. Whereas, like I said, you know, if you are personally offended by something I have said, don't tell me how dare you. Because it's only you projecting that that's actually what I said was true about you. It's true. I'm just saying. So again, you can get as upset as you want to, but I'll tell you, for those who have gotten upset, and some of them have come back to me later and said, Bleu, I got upset. I was so mad at you. And then I stopped and thought about what you said. And now I'm doing right again, and I'm starting to understand, and I get it now. I'm not here to hurt your feelings. If you're hurt, your feelings get hurt, it's because you're already in your feels. But I am here to help you and guide you. Hey, This is what you have to do, the 20 hours per week. If you're not making the time, you got to start looking for those times, like those little pockets that you can get in. Because you can't sit here and tell me with a straight face, Blue, I don't have time, and then you sit here scrolling on TikTok. You can't tell me that, because I don't believe you. Because you know that all the time you spend scrolling, that adds up. All of that time adds up. I'm just saying. All right. Let's see. What did I miss here? All right. Hi, Julie. Hi, love your channel. I'm currently self-studying. How soon should I get a membership with AAPC? Right before you pay, to take your test. Hi, Nadia. Anna, no easy way, no quick fix. There you go. Hi, Crystal. Hi, Vanessa. Top Dawn. How do I start here in Florida? What's the best route for self-study courses? What's the best route for self-study as the courses are too expensive? Advice for beginners, you can watch my channel. Vanessa, do you ever get burnt out from coding? Not the coding part. Let me explain this. It's not the coding that burns me out. It's the electronic health record. Freaking witch that burns me out. That's what burns me out. It's working with the electronic health record. That's what burns me out. Now, not all of them, because some of them are good that I've worked with, but the one that I am working with right now, that's what burns me out. It literally frustrates me so bad, because I know that it's just not very well put together. It's just not. And I know, because I've been able to go faster than this. And it's very frustrating when I feel restrained from doing what I need to do because of faulty technology. That's the only thing that burns me out. The coding that's my happy place. I actually love the coding. I actually love working with my providers. I actually love teaching. I love to teach my providers. I love to teach other coders when they're willing to listen to me. That's what I love. I love that. That brings me joy. Whenever I have a day that I know I'm on the schedule. A few years ago, I will say this. A few years ago, I had the best group of providers. Now, not all of them, but the majority of them, 90% of them, I loved, right? And so one of them, PA, was head of the education for the department. And she was very proactive with getting me to do presentations. Well, of course, I'm down to do presentations anytime, but it wasn't just for my surgeons, it was also for the techs in the clinic. And so I got to teach them. And so any day that I had to do that, like, I couldn't wait to get to work. I was so excited because it's so much fun. I love classes, and I love when there's engagement, and I love when they ask me questions. And even though sometimes when I do a class, right, and now that PA is not with us anymore. She's not working with us anymore. She's working at another place. And my time is not an hour anymore. So my time has gotten a lot shorter because there's other priorities and everything. And so the emphasis on the education side is not where it once was, which makes me kind of sad. But when I do have a shorter amount of time, I have to really truncate a lot of the message. And so I have to get even more to the point. And it's okay to do a lean education piece, but sometimes I will have a provider who comes in, especially this newer group. And they're just not, you know what it is that they're not used to coders like me. A lot of them are just barely coming out of residency, so they're used to somebody always telling them what to do. Now they're full-fledged surgeons, and they're like, oh, I'm not going to let this person tell me what to do. This little 4'11" Hispanic woman, I'm not going to let her tell me what to do. Well, I did have one that, as soon as I started speaking, he got mouthy. And I stopped the whole class and I said, do you want to do this when you leave here? Is that your plan, to continue to be a surgeon? Well, yeah. And I said, okay. So who do you think is going to do this for you when you get on the outside? Who do you think is going to give you all this education and try to help you to know what we are looking for when we're selecting codes? Oh, that's why I have my biller do that. No, I said that's not how this works. And I said because the biller, the coders, anybody that you have, the office manager, your spouse, anybody, they're just going to report what you select. Well, I already selected the correct codes. No, you don't. What do you mean? I changed 90% of your codes. What do you change so much for? Because yours are not as specific as mine. And because I don't want anything to get kicked back, I always change and update whatever's going on with yours. I said, that's why you get queries from me. I said, however, have you noticed that I stop those queries at 3? I do not go past 3 queries in a day. If I have to do more than 3 queries in a day, I'm coming for you and I'm looking for you. And I said, and so that's why I have been back there to your office and trying to help you to understand this. And I said, but if you're resisting me, I can't help you. But at the same time, I've got 30 minutes to be able to discuss with other people who want to learn. And I said, if you don't want to, I can't force you, but I'm here. I'm here and I'm always going to be right here. And if you resist me at first, I understand. But what I will not do is keep having this conversation while other people are trying to learn. Okay. Don't you know he got better? I'm not going to sit here and play this game. I will be respectful and I will be professional with you. But at the end of the day, I still have a job to do. Because at the end of the day, who's going to get blamed? Me. Because, Blue, why didn't you tell the providers this? You think I didn't? I did. I have all these emails. I have this education piece that I put out. And if they're not listening, I can't help them. I can't force you to do what you're supposed to do. But then you learn later on, these providers, they learn that, hey, maybe she was right. Maybe all of the training that she's giving us is for a reason. Because it's not to make my job easier, trust me. Because I tell them, I'm not trying to make my job easier. This is so that you can clearly convey what you're doing in that room. So there's never going to be a question about what's happening. I understand that there's going to be some times when you don't know what the actual diagnosis is. You don't know what it is. Because somebody came in with an injury, you can't see the fracture yet. Because everything's so swollen in that area. You can't see nothing yet. So that's okay. If you tell me this person was injured, I can select an injury code of a specific body part, and I can wait until you see again that patient, and then you find out exactly what they have. That is totally fine. But when you're telling me everything is consistent with, I got to go with symptoms. So it changes what they think that they're documenting as far as what it changes what they think that you are selecting. And they were surprised at how different they thought the coding was. And so, but this all comes out because we're having a conversation and it's constructive. And I'm not scared. And they know this. And that's another thing too. You know, you don't want to come in all, big shot or anything like that. You don't want to do that, but you do want to let them know, hey, I'm here. This is what I do. This is what I learned. This is why you don't have to worry about all this. I'm here for this very specific reason. So it is very important to educate and do all those things. But that will never burn me out. Do I wish more than listened readily? Yes. But no, the only thing that burns me out is a stupid electronic health record. That's the only thing that burns me out. If I was left alone with a stack of records to be able to code, I will be just fine because I wouldn't have to worry about all that. But it's the electronic health record that burns me out. Yeah. All right. Hi, Tiffany. Nuria says, thank you, beautiful and smart lady. Have a wonderful, safe weekend. Enjoy the casino. Hi, Margaret. I'd rather take my time. I want to know these things. There you go. Hi, Kylie. Hi, Nicole. Coding says, hi, I'm a freshman and I wanted to ask, should I start studying now or when I get older? What do you mean? Look who it is. Is that my Mark? Hey Mark, how you doing? Long time no see. Um, oh, you're welcome, Vanessa. Uh, sorry. Teach a medical coding and billing program. If you could, oh, there we go. If you could, would you teach a medical coding? Would you teach medical coding for people who are wanting to get into? I've been asked that several times. They're like, Blue, why don't you have your own school? Why don't you have your own program? Do y'all really want me to have my own school? Because I'm telling you right now, a lot of this stupid tabs and writing and highlighting, no, that would not happen. That would not happen in my school. But I would say that everybody that went through my school would be well prepared because I know what they're looking for. And I know I'm very detailed. I'm a detailed person. So when I see things that people aren't doing, I tend to kind of want to tell them. And so that's where my strong suit is, you know. And so, but running a school, running a program takes a lot of time, more time than I have right now. Because my plate is already pretty full. My plate is very full right now, and there's a lot of things that you all don't know because I don't bring it here to the channel. And so it's working a full-time job. It is, you know, here with you guys on YouTube and on Patreon and for my clients, because I have threefold clients. I have resume clients, I have tutoring clients, and I have professional coaching clients. And they take priority, and I have to get stuff done. Like right after I get done with this, I have a cover letter that I got to finish because there's a resume that's already due, and the resume part's already done, which I'm glad. I love that. But I have another one that's already due. So, and that I have to work on, and I have to do that on top of the other things that I'm doing. So, and you don't always tell people your plans. You don't always tell people what you're doing, because once you start telling people what you're doing and you start telling people your plans, then you got hateration out there. You got a lot of people that have their own agendas, and then you have fake people who would be like, oh yes, they're so happy, and then behind your back, oh girl, that lady thinks she knows everything. That lady this and that lady this. No. You learn that with time. You learn that with time for sure. So there's some things that you keep close to the vest. And there's just some things that, okay, everybody can know, you know. When I got my CCSP, I didn't tell people until after I got it. That included my Patreons, because I love my Patreons, but some of them get very excited because they know this information and they start saying it on the channel. I'm like, can you wait, you know? So, but it happens, you know. And then same thing with the CCS. You know, I didn't tell people that I was going to sit for the CCS either, because then you start getting a lot of questions, and more questions than I wanted to focus on at the time. So after I got the CCS, then I could say, hey, this is how you study. This is you do this. This is what I did, and this was how I was able to pass the test. So, Anna says, I would pay my, oh, thank you. Oh, thank you, Vanessa. Thank you, Margaret. Yes, you should. I wish you would, but it's wishful thinking, lol. Coding says, sorry, should I start getting into medical coding right now? Maybe, such as maybe joining programs that dive fully into how to do medical coding, or should I wait until I graduate? Are you in high school coding? Are you in high school? Yes. Vanessa, very true. But yes, so that's the thing that you guys have to understand. So, okay. I wish I would have known about coding right out of high school. I wish I would have known about coding right out of high school. A few years ago, I knew one such high school senior that went to one of those. It was like in certain areas, they have high schools that are specifically geared towards trades, right? And so this one where this fella was going, he went to a health careers high school in San Antonio. They have a health careers high school as well, and they have like business careers, and they have all these other ones. Well, where this fella is from, not San Antonio, but where this fella is from, he went to a health careers high school. And so they were doing like, what is it? They were doing MA, medical assistant. And somehow he ran across coding. Well, he started to get interested in coding. And so he decided that he was going to study for it. And he told his teacher, hey, I'm going to study for this exam. And then when I graduate, I'm going to go and during the summer, and I'm going to take my exam, and, I'm going to be a coder. And so the teacher was telling him, oh, you're wasting your time and blah, blah, blah. You should do medical assisting. And he's like not really digging that, but he liked the coding. And so sure enough, as soon as he graduated in May, in June, he took his CPC. He got a CPCA right out of the gate. And he was so excited because this meant that he could go anywhere. He could start working. He didn't have to start college right away if he didn't want to. So he had sent me a message, and he was just like, hey, I just want to let you know that, you really inspired me because, I'm a high school graduate, and I just graduated high school. I just took my certification exam, and, my teacher was like really against it, but now she's wanting me to vouch for her and say that she's a good teacher, and, because of her, I have this credential. But he goes, but that's not true. I was watching your videos, and I was studying like you said, and that was how I ended up getting this fella. Now he is a big time auditor, like big time auditor. So without giving away too much of what he does, he audits, and he's very good. He is very good. That I will give him all day long, because he is excellent at what he does. He's very smart. And I told him before, I was like, man, you get it. You really do get it. And so because he gets it, he's able to do anything. And I was like, wow, you're so far ahead of your peers and being so young, And so, I mean, that could be anybody, just literally getting into it. And then being so young and being like 18, 19, just getting out of high school, whatever, you have your whole career. And the thing that he ran into was people were not taking him seriously. So I looked at his resume, and I helped him out with his resume at the time. And then he sent it out, and he got his first job. And so from there, that's when he started building. So that would be the one thing that I would tell you is, if you're going to start, you're going to do this, you better do it now. It's okay to graduate high school and take your certification exam and then get out there and start applying for these jobs, because you have an entire career that you could be in. You don't have to get into student loan debt just coming out of high school trying to go into college. And I never recommend college for my high school graduates, because if you don't know specifically what you want to do, and even those that know what they want to do or say that they know what they want to do really don't know what they want to do. Don't waste money on a degree for something that you don't want, right? Because sometimes people, like these young kids, their parents will push them, oh, be an attorney, be an attorney. Now, I would have been all over that like white on rice. But there's some kids that don't want to do that, but they do it for their parents. Well, then now they're all these hundreds of thousands of dollars in debt because they got a student loan, okay? The great thing about being a coder is that you can be a coder for a few years and work for a facility, like work for a hospital that has outpatient clinics in it. And then you can be out there like where they do the tuition reimbursement for the hospital. You just have to promise them back time. Well, they're paying for you to go to school, and you're not having to take on all that debt. It is stupid to take on student loan debt for something that you don't even know what you want to do. But if you're into the coding and you decide to go into health information management or health information technology, and the workplace is paying for it, well, guess what? Now you really invested into the industry. You're not having to carry on that heavy burden. You're not saddled with all that student loan debt. You are where you're supposed to be and progressing like you should. And you're far ahead of your peers who are going to be drowning in student loan debt because they're out there just getting student loans left and right, willy-nilly, not really knowing what they want to do. But coding is a great place to kind of progress, but still be like, okay, well, I don't really know what I want to do. Because you can still be into the coding or later on you can go into CDI, or later on you can go into like leadership. You could be a coding lead, you could be a supervisor, you could be a department head, you know what I mean, like once you have your degree. And that's totally fine. You could like the coding side, and you could decide, hey, I want to do billing, and then you could be working as a biller, and then you can have your own billing company. And billers do quite well, but billers should also know coding. So there's a lot of that back and forth. So there's that. I mean, but to be right out of high school again and just to have that opportunity, you don't know how lucky you are to be able to have that opportunity and to be smart enough to say, okay, I have this option here that I could really make really great money and not have to worry about college for right now. You know, not that you'll never go back to college, because again, you can do really well and not have student loan debt and still make what you make being a coder, you know. And don't let other people's opinions of, oh, it doesn't pay anything. You expect people to pay you a really high salary when you're starting out and you haven't earned it. Isn't that stupid? You need to build up like everybody else, you know. So that would be my advice anyway. But absolutely, if you want to do this coding, I would go for it if I were you. Definitely. Good. Margaret. But yeah, so that would be what I would say. That's my advice anyway, is to do that. Because again, if I would have known about coding right out of high school, that's what I would have done. That's what I would have done. But I didn't know about coding until I was unemployed. And I had my case manager from the workforce office tell me about it. Because the first thing that he said was, what do you think about medical coding? I was like, oh, I don't do nothing with needles, because I knew everything, right? And he's like, oh no, it doesn't involve needles. It has to do with reading medical notes and putting it into codes for the insurance for like billing and statistics. And I was like, I could do that. He's like, yeah, it has longevity, and you know, this is the starting salary. And I was like, oh, that's pretty good. You know, starting salary was pretty good to me, you know. And so I was like, okay, well, I can do that. And so then he's like, well, you know, just check it out. And if not, because I like numbers, okay? I'm a numbers person. And so I was totally down to take the accounting class that they had. So I was like, I can do that. I can do people's taxes. I can do bookkeeping. I can do all these things, and, you know, no big deal. And he's like, well, he goes, if you go to these schools and check them out, and then if you decide that this is not what you want, he goes, just come back and we'll get you in the accounting program. And I was like, okay. I had nothing to lose anyway, because it was going to be free education. The only thing that you had to promise was that you were going to complete the program, that you were going to sit for the certification, and that you were going to find a job in the field that you were trained. I did all those things, but boy, I'll tell you what, that last one, finding a job in the field that you were trained, it took me 2 whole months, and I was sweating, because I was just like, can I get in? You know, because everybody wants experience, but I did. So, all right, nachos. I've been doing an online course and feel so overwhelmed. I feel like I'm never going to be good. I work in the medical field. Are some coders also billers? But not all billers are coders, correct? Correct. These are two different positions, billers and coders. Although sometimes, depending on where you work, the biller is also the coder, or the coder is also the biller, however you want to say it. But how long have you been, Nachos, how long have you been in the program? I used to do accounting in my old job, so I'm good with numbers. How many times can you take the CPC? Tell me how long you've been in your program, Nachos, before I answer that question. Coding says, thank you. No matter how much it takes, and it'll take a lot learning that from your previous videos. I know I'll be successful in coding. Good. I'm so glad. That's what you want. That's the kind of mindset that you got to have. And another thing that I will say, because you are so young, that I will say this, little one, make sure that you're not out here sharing with other people. because other people will suddenly become health information experts and they know, and oh yeah, AI and blah 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 blah. If I would have believed that crap about AI, I would have never be here. I would not be here on YouTube with all of you, at all, because I would never have gotten into this if I would have believed what they had to say. Don't believe people who are not in the industry. Okay? Don't believe people who are not in the industry, because you always have somebody who's coming up with, oh, it would have been this, it would have been. Are you in the industry? Are you a coder? What credentials do you have? None? Okay, then sit down. That's all you have to say. Okay? Or not say anything at all. No one needs to know your next move. No one needs to know that you're getting a certification. No one. Your parents, probably, yes. But anybody else, they don't need to know it. They don't need to know it. You need to focus on you, and you need to concentrate on you. It's so much easier right now for you because you're so young. You can have all of that soak into your head. You're not bogged down with all these things like you will be when you become a full-fledged adult, yeah. When you start having to worry about rent and mortgage and car payments and car insurance, when you start having to worry about all that, it makes it a little bit more difficult. But I mean, you're right now in your prime time, so you could totally learn this. And spending those 20 hours per week with the 3.5 hours per day, 30 minutes at a time, 1 hour at a time, taking a break here and there, listening to those things over and over again, taking advantage of Quizlet. Okay, Quizlet will help you. Quizlet will help you with HIPAA, HIPAA, not two P's, HIPAA. And it can help you with medical terminology. It can help you with coding questions. You can even put in there CPC, CCS, CCSP, CCA exam. You can put that, and like all those questions will start coming up. Okay, now you got to watch some of those questions because some of the answers are wrong, but for the most part, if you do like medical terminology, you can totally do that. Okay. You can watch the videos on YouTube, Crash Course, Anatomy and Physiology. That's the channel that you want to put in Crash Course. And they have a bunch of different ones. Any topic you want to know about, whether it's government or whether it is, biology or anatomy and physiology, they have tons of playlists on that channel for everything that you could ever want to know. So that I would be spending my time on. And think about that. You're not even having to put out all this money. You're not having to go to a stupid program because you knew enough to do your research and try to figure the stuff out before you go diving into like a trade school or something like that. I'm not saying no, trade schools are bad, but what I am saying is that if you have the opportunity to learn on your own, that's the best way. Go to the public library. The public library, if you don't have the money right now to get coding manuals, they may have coding books there. They may have coding workbooks. Okay, stay away from a workbook that starts with a B. Okay, I just want to say that, because people get offended. But there's one out there you want to avoid. Okay, the ones that I recommend, the CPC study guide, you can look for that at the public library. You can go and ask them. Sometimes they can borrow it from another library if they don't have it there. And then the other book is the ICD-10-CM and ICD-10 PCS Coding Handbook with the Answers by Nellie Leon Chizen. You do that, you go to any one of my older videos, any one of my preloaded videos, you'll see all of the things in the description box, all the books that I recommend, but it's those two books you're going to learn coding from. And you get your coding manuals, your ICD-10-CM manual, your CPT manual, your HCPCS manual. If you're going to take the CCS or the CCA, the ICD-10 PCS manual, you get those and you study 9 months, you'll have your credential. You'll be credentialed. Now, I don't know how much longer you got in high school, but I'm telling you, you can spend your time doing that now, and then when you graduate, then you have that. You can just have a good job. Just saying. Let's see. About 10 months is self-guided. These last 2 months, I started dedicating more time. Good. I work full-time as a single mom. Okay. I've been studying on my lunch break as well and right when I get home. Good. 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 So you're at that light at the end of the tunnel. part, right? When you start kind of questioning yourself and everything seems like it's a lot. It is. It is. You can acknowledge that it is. It is a lot. However, this is just the time that you're growing. So you're going to feel these growing pains, and that's all that it is. Where you start to second guess yourself, where you start to think, maybe I did too much and I'm in over my head. The thing that's going to help you though is that you're increasing your study time. And I'm telling you, if you get to that 20 hours, if you can get it to that 20 hours, 3.5 hours per day for 5 days, at 17.5 hours. And then you have 2.5 hours on a Saturday or Sunday. And then you got the rest of the time for your family. So if you do 3.5 hours, half an hour in the morning, you're waking up, listening to the Crash Course channel, Anatomy and Physiology, so you can start having that in your head, right? 30 minutes at lunchtime, you could be flipping through flashcards on Quizlet, okay? Or you can write your own flashcards, which I recommend. Then 30 minutes on your drive home, again, you could be listening to something. And then you get home, you have 1 hour, and 1 hour you could be working through your workbooks. Work through your coding manuals, and you could be working through those, okay? If you have silly tabs on your books, take them off. You don't need those silly tabs. Tabs are a crutch that you do not need, okay? You need to know how to use the manual. That's what you need to do. And you're not going to learn it sitting here staring at the side of the book trying to find what you can be so good. If you study the 20 hours per week, you could be so good that you can go by feel and get either on that page or very close to that page. Because I can't tell you how many times I've done that in front of my providers. I'll have the book with me, and then they'll say, oh, we'll start talking about code or whatever, and I'll grab the book and I'll just flip it open, and sure enough, it's right there. They go, how did you do that? You didn't even have the bookmark, Blue. And I said, I work with these books a lot. So I already know by feel where I have to be, So that's the way you got to be too. But you got to get that time in. If you, and trust me, 3.5 hours per day is nothing. It is nothing that you can't manage, okay? And just listening to something and working through the workbooks and doing all these things. And then having just 2.5 hours on a Saturday or Sunday. And then that's it. You got the rest of the time for your kids or your kid, So that's it. You just have to make the time. It's just making the time and making it a priority. And this is not forever. This is just for the time that you are really studying, trying to get done with your test. Because you will feel less overwhelmed the more time you put with it, because it will be more familiar to you. The people that are really overwhelmed is because they're not spending enough time with the books. They're not spending enough time with the book. If you are not spending enough time studying, it will be overwhelming. You will be scared when you go into the test because you didn't study enough. So that's what I recommend. Okay, you got to make sure that you're doing that. You got to buckle down and you got to make that time. And if you have people around you, I don't know what your situation is in your home, and this goes for anybody, not just you. If you have other people around you that are telling you, oh, well, I don't think you should do this, I don't think you should do that, you don't have to share what you're doing every single time. Okay, you can make time. You're not always together with all of these people, especially people that are trying to be negative to you. Okay, don't listen to them, because sometimes there'll be people that they'll have their heart in the right place, some of them, and they'll be like, oh, I don't think this, I don't think that. They need to allow you to see something through. Okay, because you have, especially if you have kids, they're watching you. They're watching you and they see what you do. And if you quit, they will quit. And they'll say, oh, my parents quit, so I can quit too. And then you have another generation coming up of quitters. Okay? That one lady, she got so mad at me. She was like, oh, I'm not lazy, blah, blah, blah. Then she said, well, I'm going to quit. And you're just so mean. And then she's like, I'm going to go back to paralegal. You think being a paralegal is easier than being a medical coder? So you mean to tell me that legalese, that you got to know legalese when you are a paralegal. You got to know legalese. You got to know the law, right? And you have to know how to look things up and do all of these things, and everything's got to be right. You think that that's going to be easier than coding? You want a reason to quit. You want a reason to quit if you're doing that, if you're bouncing back and forth. You need to see things through, and you need to feel that uncomfortableness of gosh, I don't understand this. This is hard. You know that song? I don't know how I did it. I just did it. It was hard. Yeah, that's going to be you. And you'll find that even though you may feel like this is so difficult, when you look back on it, hey, that wasn't so bad after all. I actually did better than I thought, because you're now into this. This is part of the growing process. So don't ever shy away from those feelings of discomfort. It's the shying away from the feelings of discomfort that's making this next generation just so sensitive about everything. You can't be sensitive about everything, guys. Life is hard and it will beat you down, and especially if you let everything get to you. If you get so overwhelmed. The other lady was saying, I get so overwhelmed. I said, ma'am, you're learning this. You're not going to walk in knowing it. We have to know what doctors know while never having gone to medical school. Did you hear me? We have to know this stuff. When they're writing this stuff in their notes, they're not thinking, how can I make it easier for the coders to understand? They're writing in doctor. They're writing in surgeon. So they're writing the way that they were taught in school, right? For 10 or 15 years that they were in school. Not to mention all the fellowship stuff that they go through too. So these people have been to school for years. We get to learn coding in 9 months, 12 months, or 18 months. And we still got to be able to make sense of all of that. I love listening to doctors when they're talking to each other and not necessarily talking to like a patient or anything like that. Because the way that they talk to patients is different from how they talk to each other. And spending time on a surgeon's hallway, trust me, because my office used to be on the surgeon's hallway. And so just leaving the door open and listening to them talk to each other, it sounds foreign at first. But when you actually spend the time to start understanding what they're saying and start looking stuff up, you know, like when they're talking about a procedure, when they're talking about procedures and they're talking about technique, and some words that they're saying, like, I don't understand. I was like, let me look up that word. What does that word mean? I was like, oh, that's what that word means. And so that it goes a long way to understanding the way that they document and the way that they write. So there's a difference there when you understand and you know that. Okay, so I'm just saying. But it's not anything to be overwhelmed. This is stuff that's going to build over time. Remember, for me, I've had 17 years. I'm talking to you as a 17-year veteran. So I've been after this for that long. But if you're new, this stuff will come with time. It's not going to be there overnight, but you just got to get your basics down. Medical terminology, your anatomy, at least know what where your bones are, your muscles, your tendons, and what each one of the organs is for. What is its function and what does it do? If you can at least learn all of that, that's going to be a good foundation for when you start looking up codes. I'm just saying. All right. Okay. How many times can you take the CPC exam? As much as you want to, because AAPC is a business. They are not going to put a cap on how many times you can take it. However, I will say this. If that's what you're worried about right out of the gate, don't, because you're focusing on the wrong thing. You need to be focusing on, how can I study for this test with my 20 hours? And that way I can start focusing on, okay, this is what I need. Don't just study with the CPC study guide. If you're studying for the CPC, you also need to try to get that Nelly book, because that Nelly book is going to help you to understand the diagnosis coding, okay? And you can skip the PCS questions. And in the back, they have all of those scenarios that you can go through for like the ER and things like that, where you could be coding for the diagnosis. That's what you also need to be working on. So trust me, you get that practice into, that's going to really help you. But don't focus on how many times can I retake this test, because they're a business and they'll take your money as much as you'll be willing to give it to them. Okay. Anna says, I quit sharing my goals because, yes, all of a sudden people are experts and specialists in everything. LOL. Yep. During the week and all weekend long. Okay. Yep. People are jealous when you are succeeding. Yep. Girl, yes. Yeah. Yes. I wonder what What in the world was I thinking? Darlene says, at my age, my course is a marathon, not a sprint. There you go. I love learning coding. I think of it as interpreting a story into numbers. It's quite fun. Yes, it is. J-Line says, Blue, is it normal if I'm studying 24 hours a week? I feel I am in like half of my study, self-study, feeling so easy to find correct codes in my ICD-10-CM. I got some imposter syndrome. Imposter syndrome does happen. 24 hours is good, but like I said, 20 hours is fine. 24 hours, I would not go over that. I would not go over that. Some people get up to 30 hours and say, oh, well, I don't have a job, so I'm doing this as like my job. 32 hours is what I'm doing. And that's fine. But I kind of caution people, you got to be careful, because especially if you get to that many hours per week, you start to burn out faster, and then nothing starts to stick, because then all of a sudden it gets to be a lot all the time. So between 20 and 24 hours is fine. I still recommend 20 hours. You will run into imposter syndrome because it is a lot. And imposter syndrome, if you don't know what that is that you feel like you're not smart enough to be there. You feel like you're a fraud because you feel like maybe you don't belong, and you feel like everybody else is smarter than you and you're not good enough. And that happens. You know, it happens. But it's just something that you will learn over time, that everybody feels self-doubt, and it's just how they manage it is what makes the difference. Because if you get too much into your head, like, oh, I don't belong, I'm not smart enough. And I really hate when people are self-deprecating, when they really say, oh no, I'm not that smart, I'm not. Take a compliment. If somebody's genuinely giving you a compliment, or you're doing genuinely well and your teacher says, hey, you're doing great, or somebody notices that you're studying, you're doing really good, that's the thing. And if you're catching your errors, then that means you're studying properly. You know what you did wrong. You can identify it, because you can learn coding on your own. And so that's something that you should be proud of, because when you're doing something like that, it's a lot. And maintaining that concentration is also going to be something that, is going to be a constant challenge. But the only one who can get in your own way is you. Okay? And there will be people that will try to put you down because they don't want you to do better than them. Okay? They want you to, be not coming out, into something wonderful like you want to. Because some people believe that if you work a job, you should be miserable, right? And that you should only be happy when you retire. But that's not true. For me, I love what I do. I get excited to go to work. Yes, there are some things at work that are chores, for me to do. But for the most part, I love what I do. I enjoy working with my providers. I like the challenge that some of them will present, because when I eventually break through their very stoic veneer sometimes, it's a good feeling. When they learn something and they can carry it forward with them in their career, and they learned it from me, that's also awesome, But you don't get there if you always doubt, okay? You need to be your own biggest cheerleader too, okay? You're putting in the work, acknowledge it for yourself. Don't expect acknowledgement from anybody else. If you get it from other people, if you have like really good support system around, then you're very lucky, okay? I was very lucky that my mom was my support, because not everybody has that. Not everybody has good support from their parents. When I was in school, and I would hear the other ladies, and they were older than me. I was still really young, and they were older than me, and they were saying, well, my mom doesn't think that I'm smart enough. I said, what? Like, I expect that from like maybe their partner or something like that, and then somebody else says, oh, my husband doesn't think I'm smart enough too. I'm like, what? You know what I mean? Like, why? I mean, the husband I could get, but like, I didn't understand the mother. Like, really? You don't think your daughter is smart enough? She's in school. She's trying. And you don't think that she's smart enough? Really? Like, why would you do? So again, it's great when you have a good support system, because my mom would hear me cry sometimes because like it got to be a lot. And at the time I was going through a divorce too, so I had all of that in my head. And so trying to stay focused, and she would get me right back into focus. And she would tell me, you know what you're doing this for. You're doing this so that you can do better for yourself and you can be able to, go forth and do great things. You know, you got to stand up and you got to be strong. That's the thing she would tell me. So, and that was a good thing. Okay. And like I said, sometimes you'll have somebody right there in your corner genuinely cheering you on. And then you'll have other people that'll be like fake to your face or, whatever. So, but if you have somebody that is really, really good and they really support you, make sure that they know that you appreciate them. At least tell them thank you. I told my mom several times that I was so glad that she was there for me. And I say it to this day that I would not have my career if it wasn't for her. So, Nachos says, my daughter definitely encourages me, and I definitely encourage her. She's in high school, and I know she struggles. I want to set a good example and follow through. Good. Nacho says, please say which books are the best to study. New York. In my other videos, I have the rate on there. I don't want to say, because if I do and I change the rate, people could get mad. The Nelly book is the ICD-10-CM and ICD-10 PCS coding handbook with answers, because they have a without answers version, but with answers by Nelly Leon Chisholm. I'll put it in the box. Nelly Leon Chisholm. Is it with an L? It doesn't look right. Yeah, it is right. Okay, see, this thing thought I wasn't spelling it right. I have the Nelly book. I think the 2023 with it. You know what? And it's the same thing. It is the same thing. I know it's backwards. Save your comment. But yes, it is the same thing. It's got the same questions. The only thing is maybe some of the codes have been updated from the 2025 versus 2023, but not a lot. If that, you probably would find the same code anyway, And if you didn't find the code, then you would know that code is updated. Okay, so then you can figure it out after that. But yeah, it's the Nelly book. But yes, this one and the CPC study guide. Even if you're taking an HEMA exam, I still recommend the CPC study guide, because the CPC study guide is very easy for new coders to understand. Okay, so even if it's a few years old, it's okay. It's hard to find the 2025. Yes. So, but yeah, if you can find a older version, it's totally fine. Try not to go back further than 22. If you can find a 21, hey, I mean, that's the best you can do. But the newer ones, like 22, 23, 24 would be really great. No, it's not too old. Liz, it's perfect. Yeah, that's fine. I found the 2025 with AMA. AMA has a book? Or are you talking about their website? So yes, don't worry about imposter syndrome. Sometimes we have to kind of put that in the back of our head, because it happens. But it's not what we think. We don't have to believe what we think. Every Every fleeting thought that we have, we do not have to believe. Did you know that? So if you have this fleeting thought of, I don't feel like I'm good enough, we can just tell that part of our thoughts to just shut up. Because yeah, you are good enough. Yes, you do deserve better. Yes, you do deserve to be happy in a career that you have, and all of these things. It's okay. No one can take anything from you that is yours, which is your knowledge. No one can take that from you, but they will try, and if you let them, they will succeed. Again, you don't have to believe every horrible thing you tell yourself, or every horrible thing somebody else tells you. You're not good enough. You're not smart enough. You'll never do this. You'll never do, because you always quit everything. Don't quit. You can want to quit, but don't quit. You can curse and still work and be able to do all those things. Yes, because I am not always sitting here happy and smiling when I'm looking up a code. Sometimes I'm fussing too, because it's just like, really, where? And so those are things that do happen. Not everything is all sunny all the time, but you have to just grow with it so that you can get that full maximum benefit of being in this field. Because it's not just this that you'll learn from and grow from. It'll be your next position, or your next position, or a provider that you teach. You'll learn from them, whatever. Oh, okay. Oh, good. Okay, Cindy. All right, the 2025. All right. But yeah, the 2025 is great, but like I said, 24, 23 is going to have the same thing. Just maybe a few of the codes updated, and that's it. Yep. So, but yeah, and then another lady on that post on LinkedIn, I was gonna say Facebook. What did she say? She said, oh, I like what this lady said too. She says, someone I know who was a bartender, I thought she was talking about me, because I always say that I was a bartender before, told me, but it wasn't me, but told me they were going to learn coding. When I advised getting a receptionist job or the like to get some medical knowledge, I was informed that they were a radiology tech. They've been a bartender or server in the many years I've known them, but okay. That'll maybe give you some medical knowledge, but does absolutely nothing for coding rules and guidelines. No appreciation for what I was saying. And I said, that's a shame, how ungrateful. And I said, but I know your heart was in the right place. However, I would kindly advise you not to advise others to start in reception. There's too much education with coding to start off there, especially if they know, like the employer, if they know that you know how to code, there will always be people that are willing to take advantage. I never recommend that for new people. Billing, yes. Claim reviewer, yes. Prior authorizations, yes. Reception, no. Secretary, no. Patient access, no. These positions don't use your skill. So, that's the thing. You have to be very careful, because there will always be somebody that's going to try to take advantage. Always. And especially of your knowledge. This one lady told me that she was working with a doctor, and he knew that she knew how to code, and he kept her on as a secretary and then made her do the coding. And then he says, well, maybe I'll give you a job as a coder. And he kept stringing her along for years. She was like that for 3 years. And I'm like, and you didn't think to go anywhere else? She goes, well, I wanted to get more experience. I'm like, no, absolutely not. He was stringing you along, and he kept telling you no. He wanted you in the secretary position. Guess what? Now he's got 2 positions out of you, a secretary and a coder, and probably the denials, because you help with the billing. So that's the thing. And what are they paying you? Not what you would be earning as a coder. And she told me what she made, which was well under what she was performing because of what she was doing. And I said, ma'am, we don't work for free. Don't do that no more. I said, once you get done with this, then you need to go be looking for a job. You know, you need to find a job that's going to pay you your worth. And especially for all the things that you've been doing for that practice. Get out of here. Making her work for free. Really? We work in a multi-billion-dollar industry and there's still people that try to get people to work for free? Absolutely not. Absolutely not. And like I said, patient access, secretary, receptionist, what are you doing? That has nothing to do with the coding. It's very front facing, like patient front facing, which is very important, right? This is important to have people who do that, but it's also important to have people in there who are that at that skill base, not people who are advanced in skill base, because then all of a sudden the line starts to get blurry and then you end up doing other things. Absolutely not. For what they paid, no, I don't think so. And you're wasting time at that point. Anna says, once you are done with the exam, do you recommend selling back your books? No. Cindy says, I currently have a similar situation where my current employer will not pay me more for mostly billing and some coding for PT and OT, and I cannot wait to get my CCS and move on. 6.5 years experience doing this. Cindy, my God. Oh. You deserve better. And that's horrible. I would be like, I don't know anything about coding. How do you like that? You didn't get hired on as a coder. How do you like that? You know? New York says, Blue, I love your transparency with all your guidance for new and experienced coders. Thank you. Yeah, Cindy. Oh, I would give you such a big hug right now because I feel so bad. 6.5 years. Gosh. And no remorse. None, right? From that doctor, right? From that office. Nothing. Oh, they'll do it because they want to do the coding. But I need them here. And that's why I say you can get stuck. You can get stuck in patient access. You can get stuck being a secretary, a receptionist. Because if the patients like you, yeah, you're staying. And HR won't help you. HR is for the company. HR is not for you. HR is for the company. So that's what y'all need to understand. There's a difference. And oh no, they're supposed to be here to protect me. Unless you belong to a union, ain't nobody protecting you. There's no one's protecting you. You got to look out for yourself. Okay? Oh God! Now you're just throwing sand in the the whole problem, Cindy. Oh my God! You need to move on. You need to move on. Are you certified now? Do you have a CPC? Tell me you got a CPC or something. No. So you're not certified at all. Not yet. Ma'am, what are you waiting for? 6.5 years of practice, what are you waiting for? What are you waiting for? It's like I told that one lady, she's a biller, and she says, "Hey Blue, if I don't have a GED or a high school diploma, will my certification, my CPCA still be valid?" And I said, "Ma'am, you have to have your high school diploma or a GED before you take your exam." And she said, "Oh, okay, well, because I've been a biller for 25 years and you know, I just didn't finish. I got one, she's got one thing to finish up for her GED. I said, "Ma'am, 25 years?" I said, what are you waiting for?" And I told her, I said, I put it in caps because I care. Like, what are you waiting for? She's like, "Well, I do really well as a biller." No, she's vastly underpaid because she told me what she makes. And she's vastly underpaid for all of those years of skill. Really? And you know it's because they probably know that she doesn't have a high school diploma or a GED, and that's why they're taking advantage. So I told her, you need to get your GED, that way you can have more doors open for you. And so she goes, "I will. You need it before you get your CPC." She said, "Okay." What are your thoughts on contract jobs for new coders Contract work kind of scares me because it's not stable. You need experience. You need experience. If that's the easiest job that you can get to get experience, that's not your forever home. Your first job will almost likely not be your forever home. My first job was not my forever home. I started off at the Cancer Therapy Research Center, and then I went to my second job, which was at a hospital, and now I'm here at my forever home. So because of that, you may have to bounce around for a few places. Don't be scared just to take a job because, oh, it's contract, it's not stable. No, but you can also be applying while you have that job so that when you can get something that's more stable, you can leave that job. If you can easily get into there, then you can easily find a job. Okay. But I will say this, for those contract jobs, there's a lot of things that you should know, as far as like sometimes they're not giving you your productivity or your accuracy, so you don't really know. I don't know what the deal is, but I've heard people say that too. So that's something you got to keep your eye out on, okay? And sometimes it's the same thing, and sometimes it's just risk adjustment coding, which is just diagnosis coding, which if you stay in that too long, I will always advocate that y'all don't stay in that more than 6 months, because if you are in risk adjustment coding for 6 months, that's already a long time to just be only diagnosis coding. And somebody said, well, it includes CPT codes as well. Whatever. Traditionally, risk adjustment coding is just diagnosis coding only. Okay. And so you don't want to get stuck with just diagnosis coding because it will stunt your growth. And sometimes employers will not count that as experience. So you don't want to get stuck there. People always write me 4 years in and say, oh, well, I've been here for 4 years and I want to get out, but I forgot CPT. How do we fix that? We fix that by practicing our CPT. Cindy says, well, to be honest, OT, ST, and PT are a very small portion of the coding. I would still say, I don't know how to do coding. Hi, Alexandria. Great to see you. Haven't seen you in a while. But yeah, I would be like, yeah. Matter of fact, I don't know nothing about coding. What is ICD-10-CM? That's what I'd be saying. Why are you going to keep wearing multiple hats? They need somebody who they're actually going to hire on that has that experience, has that skill, because trust me, people can mess that up too. People can mess it up too, and sometimes there's things that are missing. Just saying, but but six and a half years, ma'am. We need to get our certification, and don't be afraid. Just get in there and study so you can take it and move on. You have experience coming in, so it's not going to look so bad. Okay. Get your experience and move on. Okay. Get your certification and move on. You're welcome. Bilingual. God, you just broke my heart. Yes, make sure you move on. Apply, even when they're asking for experience, because you do have experience technically, but apply. Yes, I've missed you. Work has been busy and the kids are home for the summer. Oh. All right, y'all. I have a cover letter to finish. I have a client to send their resume tonight, so I have to wrap this up. But it was great. Thank you all for being here, especially on a Friday night, because I wasn't here yesterday. But it was for a good cause. It was for a good cause. Cindy, I found you late in my journey, but I am following all your advice. Good. Gina says, I have a COCA and a CPB and want to work in outpatient for my first job. What are your thoughts on the flood of HCC contract jobs for 6 months just to gain some experience? Did you hear what I just said, or did you just come on just now? Because I literally just said that. I'll rewatch. Good. Thank you. All right. I still don't understand why people get the COC instead of getting the CPC. I don't understand it. I don't understand why they would choose COC over CPC. Everybody asks for a CPC. Between the COC and the CPC, they ask for the CPC hands down more often. Why would anybody get a COC? I'm curious for me. I'm just curious for me. Not saying anything bad. I'm just asking. You're welcome, Crystal. Maybe they're scared. That's my fear. Feel the fear and do it anyway. Feel the fear and do it anyway. Well, y'all have been a great audience, and it's been nice to see some of my regulars that I haven't seen in a while. So thanks, guys, for being here. Appreciate y'all. Have a great weekend. I will see y'all on Monday. Monday. What am I talking about on Monday? I have some ideas for next week. I was jotting some down. Oh, yeah. I'm talking about coding next week. Y'all better watch, okay? Don't make me do like that lady that does. Have y'all seen her on Instagram? Where she is her and her boyfriend. The boyfriend loves plants, and so he's always talking about the plants, and she's like, and y'all better watch, and y'all better clap. Don't make me get like that, okay? So, talk as much as you can about the CCS. One of the shows is about new patient versus established patient, right? And then one of them is going to be about when you can code for 2 E&Ms in the ER. So, fun stuff for next week. But I hope you all watch, okay? Because it's to help you all right? You're going to be famous for us. You're too famous. Aw. I'm new. When is the next live? Sorry, I'm not sure, but I love your videos and want to start watching your lives. It's either going to be Monday or Tuesday. I'm going to be filming. I'm filming tomorrow, and I have some appointments tomorrow too. But I will be filming, so I will schedule it, and then I announce on LinkedIn what I'm gonna talk about, like what day. So, and if you're subscribed, you'll get a notification if you hit the notification bell, so that will help. With the lives, this just happened to be, I was live because I wasn't here yesterday, and normally I have my shows Monday through Thursday, but like I said, yesterday I was not here for a good cause. But I wanted to come on because YouTube doesn't like it when people are consistent and they stop being consistent, and I'm consistent, and I don't want to fall out of favor. So that's what I'm gonna do. So Monday through Monday through Thursday is when I have my shows. So like I said, if you follow me on LinkedIn, you'll hear that. I usually announce like what I'm going to be talking about. So, but yes, so 2 E&Ms in the ER, and the difference between new patient versus established patient. All right. May YouTube be every. Thank you. All right, guys. Thanks, guys, so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.